All right. Just the Rosenbaum right there as provided. Go ahead and plug this back in. Hello, sir. My name is Joey. I'll be your nurse today.
Thank you.
All right. Today I'll be performing a head-to assessment. Is that all right?
Yes.
All right. Patient's name is Mark Chandlee. His vitals are blood pressure is 130/80. Respiration rate is 15. Pulse rate is 65. Do you have any pain today, sir?
Not really.
Okay. Well, how would you rate that on a scale of 1 to 10?
1.
A 1 out of 10 for this pain rating. His BMI is 3.5, meaning he is overweight. His total weight is 220, and his height is
5'9".
5'9". All right. Patient is able to hear and comprehend me. He is able to follow basic instructions when asked.
Yeah.
All right. What's your native language, sir?
English.
Wonderful.
I don't need a translator.
All right. I examined the patient as he walked in and noted that he did not need any mobility aids of any sort. He had full range of motion upon walking in. His gait appeared to be straight and ordered. His speech also appears to be clear and concise. No his voice sounded clear and concise. All right. Patient is obese. All right. His skin is consistent, and he does appear to be his stated age of 42. All right, sir, let's go ahead and move on with the assessment. I'm going to go ahead and palpate your head. I'm not noting any swelling. His hair is consistent. No bald spots. There appears to be no marks or lesions on his skull. He's normocephalic. Was there any tenderness there, sir?
No.
Wonderful. Go ahead and palpate the bony structures of the head. All right. Was there any tenderness there, sir?
None.
All right. His face appears to have consistent coloring across the body. It is a tan. His skin is warm, moist, soft, and smooth. All right. I'm going to go ahead and ask you to go ahead and clench your teeth for me. You don't have to do it that. It's just like this with your mouth closed. There we go. Go ahead and open your mouth all the way. Full range of motion on TMJ. No crepitus. Was there any tenderness there?
No.
With the ability to clench his teeth as well, that is cranial nerve 5 intact. Go ahead and do me a favor. Go ahead and smile, frown, close your eyes tightly. All right, that's cranial nerve 7 intact. All right, if you go ahead and do me a favor and shrug your shoulders. With the ability to shrug his shoulders, the patient also has his cranial nerve 11 intact. All righty. I'm going to go ahead and move on to the eyes. Do me a favor, sir. Hold this 14 inches from your face and read it as well as you can.
95, 874, 28, 43, 638, 8745, 63925, 4283, 85, 37425, 8, 937, 928, 4, 2, 0, 2, 3, 9.
All right. Patient has 20/20 vision. All right. Go ahead and do me a favor. Just go ahead and keep your head pointed towards this pen and just follow my eyes. Or follow my hand, rather. Okay. That is the range of that is the movement of his eyes. They were consistent. That is cranial nerves 3, 4, and 6. All right, if you go ahead and do me a favor, sir, go ahead and stand on up. Upon reading the Rosenbaum, he also demonstrated his cranial nerve 2 was intact. You go ahead and do me a favor. Go ahead and tell me when you can see my hand.
See it. See it. See it. See it. See it.
Patient has demonstrated that he has full peripheral vision. You can go ahead and take a seat. His full peripheral vision, that demonstrates his cranial nerve 2. All right, if you go ahead and do me a favor, go ahead and just look straight at me. Patient has consensual and direct pupillary response. Just look straight ahead for me. That is direct corneal reaction in response to the light. You'll do me a favor, look at this pen, look at the doorknob. Look at the pen, look at the doorknob. Patient has demonstrated accommodation. His eyelashes and eyebrows appear to be consistent in color and distribution. No holes, no lesions. Go ahead and close your eyes for me. Go ahead and open them. All right. Your eyelids appear to be intact without lesion. Is there any tenderness in your eyes? Eyelids?
No.
All right. Go ahead and do me a favor. Just raise up. Do like this right here. And go ahead and down. Like just from the bottom of me. Conjunctiva is pink and smooth. Moist. Wonderful. Without lesion. All right. I'm going to go ahead and inspect the cornea. Without lesion, they are clear without glaucoma. I've also noted that the sclera is white and without lesion. His irises are green and brown. Looks like. Pretty eyes there. His pupils are round and intact. So patient has demonstrated perla, meaning their cranial nerve 3 is intact. All right. I'm going to go ahead and inspect the ears. They are symmetrical. Ears, they are without lesion. Go ahead and palpate those. Any tenderness there, sir?
No.
All right. There is no discharge or lesions within the ears. I'm going to go ahead and conduct the whisper test.
Computer, pen, apple.
Mm-hmm.
Phone, remote, TV.
All right. Patient has passed the whisper test, and his cranial nerve 8 is intact. Wonderful. You can hear. Go ahead and do me a favor. Go ahead and take a deep breath in through your nose. For bonus points, cranial nerve. Can you smell anything? Or can you smell more?
I can smell like I normally can. There's no sense in the air.
So it's no.
Other than your cologne.
Cranial nerve 1 is intact for bonus points. It's the olfactory nerve. All right. I'm going to go ahead and palpate the nose. Is there any tenderness here? Is there any tenderness?
No.
All right. There's no tenderness in the nose. I do need to ask you, sir. What's your name?
Mark.
Where are you?
I'm in this room.
All right. And what year is it?
2021.
Patient is alert and oriented ×3 to person, place, and thing. I am going to quickly take a break here and palpate his temporal pulse. It is strong with 2+ regular rate and rhythm. All right, I'm going to go ahead and inspect the nose. If you go ahead and just look straight up at the neck for me. Your nose is without lesion or blockages. It appears you are patent. If you'll go ahead and place one finger on your nose, blow out, and do the same on the other side. Patient has demonstrated patency in both nostrils. Alrighty. Nose appears symmetrical on either side of the face. No lesions. Severe tenderness was reported. Alright. Moving on to the mouth. Go ahead and take a look here. The lips appear to be smooth, moist, without lesion. Go ahead and do me a favor, open your mouth for me. Teeth appear to be all present, 28 teeth. Go ahead and lift up your tongue for me, sir. Bottom of the mouth appears to be intact. Soft and hard palates are also intact, pink and moist. Go ahead and do me a favor, say ah.
Ah.
All right, I'm going to go ahead and depress your tongue. Say ah for me one more time, sir.
Ah.
Hilar movement and tonsillar movement are normal centric. No issues whatsoever. They don't appear to be swollen. Do me a favor, go ahead and do the list of gag reflex here. Okay. Patient has a normal gag reflex. That's cranial nerves 9 and 10. All right, if you go ahead and do me a favor, go ahead and swallow. That is cranial nerves 5, 7, 9, 10, 11, and 12. Breath was without odor. Without odor, I didn't see anything coming up there. Patient, yeah. Teeth are straight and white. Gums appear to be pink and without lesions. Okay. All right. You'll do me a favor, sir. Look straight up at the sky. All right. Trachea appears to be in line, symmetrical. Cannot palpate thyroid. Okay, go ahead and look straight down. Put your chin to the chest. Go ahead and rotate your sorry about that. We had a person come in on our exam. Go ahead and rotate your neck forward. Okay, you do it the other way. Okay, full range of motion in the neck. I went ahead and pulsated both carotid arteries, 2+ regular rate and rhythm. They are strong. I didn't pulsate them at the same time because you would pass out if I did. I'm not trying to have a passed out patient in the exam room. Go ahead and look straight up again for me, sir. Your skin is consistent without lesions. Is there any tenderness right here?
No.
All right. Your neck is symmetric. I was also unable to palpate his thyroid. I'm going to go ahead and do that again. I'm unable to palpate his thyroid. Okay, I'm going to redo this test real quick. Go ahead and show your shoulder for me. Wonderful. That's cranial nerve 11. I'm going to go ahead and palpate these lymph nodes. Tell me if there's any tenderness while I'm doing this. The preauricular, the postauricular, the occipital, submandibular, sublingual, 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 submental. There we go. That's submental. The anterior cervical chain, posterior cervical chain. Go ahead and shrug your shoulders for me. Just keep them shrugged for me. The supraclavicular and the infraclavicular. None of those were swollen. There was no tenderness reported, and none of them were modal. I was not able to palpate them, so how would I get them to move? All right. All right. Head and neck. All right, I'm going to go ahead and assess your range of movement on both arms. Do me a favor. Actually, I'll let you do it first. Go ahead and just rotate your shoulders. Go ahead and act like you're doing some dumbbells. Go ahead and rotate your wrists all the way around and clench your fingers. That is full range of movement in the arms, elbows, wrists, and fingers. Full active range of movement. I'll go ahead and assess the passive range of movement in the patient. There was no crepitus, and is there any tenderness, sir?
No.
This is full passive range of movement in the patient bilaterally. Hands appear to be clean, turgor, no tenting reported. Capillary refill is less than 3 seconds. Go ahead and flip your both hand arms for me. Radial pulse bilaterally, 2+ strong, regular rate and rhythm. Go ahead and brachial pulse, regular rate and rhythm, both are strong, 2+. Go ahead and palpate arms for edema. There is no edema here. Is there any tenderness here?
No.
All right. Skin is consistent with the rest of the body. There is, however, there is a rather large lesion here. It's going to be a tattoo. No tenderness here, sir?
No.
Okay. Go ahead and inspect the other one. There is another tattoo right here. 2 tattoos even. Is there any tenderness here, sir?
No.
Alrighty. Skin is consistent with the rest of the body outside of the tattoos. No edema. I've already palpated. There's no tenderness in any of those areas. Full range of motion. Go ahead and do your arms like this for me. Go ahead and push against me. Okay. Go ahead and pull against me. Okay. And then go ahead and grip both my fingers and squeeze. 5 out of 5 on the strength test. 5 out of 5 on the strength test. Wonderful. Bilateral upper extremities. All right. Moving on. We'll go ahead and do me a favor. Expose your chest for me, sir. All righty. Okay. Upon initial inspection, let me go ahead and do that right there. Skin is consistent with the entire body. Is there any tenderness here, sir?
No.
None at all. Wonderful. No swelling, no tenderness. Skin is consistent, warm, moist, and soft. Same with the arms. All right, I'm going to go ahead and also take the breathing noises. If you'll do me a favor, just go ahead and breathe in and out for me. All right. No adventitious sounds. Breathing is unlabored and easy. All right. If you'll go ahead and I'm going to go ahead and also take for part sounds. Aortic. Pulmonic. Excellent.
You have to speak up. You got those things in your ear. Microphone can't pick you up.
Mitral. Or tricuspid, rather. And mitral. All right. In case you weren't able to hear me, aortic, pulmonic, Erb's point, tricuspid, and mitral. I'm going to go ahead and auscultate it with the bell. Okay, one more time. Aortic, pulmonic, Erb's point, tricuspid, and mitral. All right. Normal heart sounds. S1, S2, no adventitious noises, no issues. Regular rate and rhythm. Was there any tenderness at all?
No.
Wonderful. All right. Now I'm going to go ahead and do a posterior back. I'm going to go ahead and pull this chair up, sir. Will do me a favor, go ahead and sit down facing towards the wall. There is another tattoo right here. Skin is consistent outside of the tattoo. Skin is warm, moist, soft, and smooth. There appears to be a few lesions or just some freckles here and there dotted around. Is there any tenderness here, sir?
No.
All right. I'm going to go ahead and also take the 10 points on your back for pulmonic noises. Go ahead and breathe in and out for me. All right. Next, I'm going to go ahead and also take the 7 points, starting on the right, ending on the right. Breathe in that for me. right, wonderful. No adventitious noises. Breathing appears unlabored and easy. Spine appears to be straight. No note kyphosis noted. All right. All right, sir. You can go ahead and stand back on it and return to your seat while I move this back in place. All right. If you'll go ahead and do me a favor, sir, lean back in your chair.
Is it okay if I lay down?
Sure. Wonderful. You go ahead and expose your stomach. Is that all right, sir?
That's fine.
All right. Appears to be regular configuration, a 1-to-2 ratio. Stomach is rounded. Not seeing any. I am not seeing any lesions or scarring of any sort. That's a lie. There's a scar right there. All right. No pulsations, thrills. There was no paradoxal movement in the anterior chest. There were no heaves or thrills and up there either. All right. I'm going to go ahead and oscillate. I'm going to listen in for bowel sounds for 15 seconds in each quadrant. I request that you don't fall asleep, sir. There are normogastric sounds all across the umbilical area. No, no adventitious noises. Nothing hypo or non. Everything is normal gastric noises. Go ahead and oscillate for through the epigastric area. All right. There was no bruit to be detected. It also bears mentioning at the beginning of the assessment, I also noted that the patient was calm demeanor. He didn't appear angry or anything. Let's see. All right. Now on to the lower extremities. Sir,
Yes.
do me a favor, go ahead and
Sit.
sit back up. Go ahead and kick your feet back in. All righty. Is there any tenderness here, sir?
No.
No edema. Is there any tenderness in your joints here, sir?
No tenderness in my joints.
All right. The heel appears to be intact. No issues with the heel. It seems to be in all working order. All right. Skin appears to be intact without lesions. No. It appears warm, moist, without lesions again. toenails appear clean. Capillary refill is 3 seconds, or less than 3 seconds. There was no edema to be reported. All right, go ahead and um, rotate your legs at the waist. Okay, the other one as well. Okay, bend your legs, both of them. Okay, a little bit of crevice there. We haven't talked about it. Go ahead and rotate your legs. Wonderful. Your ankle as well. Perfect. Punch toes for me. Full active range of motion. I'm going to go ahead and repeat this process, but passively. No crepitus. Was there any tenderness here, sir?
No.
All right. Full passive range of motion as well. No crepitus or tenderness reported. Let's see. I'm going to go ahead and take his dorsal and tibial pulse. Strong +2 bilaterally. Tibial pulse is strong +2 bilaterally. I'm also going to, if you go ahead and reveal your chest one more time for me, sir. I'm sorry about this. Apex of the heart, regular rate and rhythm is strong. All right. There we go. All right, if you go ahead and do me a favor, sir, stand on up. Bend over at the waist. Full range of motion in the waist. No kyphosis, no scoliosis. Okay, spine is symmetric. Go ahead and sit back down for me. Legs are symmetric, so are arms and neck. Facial features are symmetric. Ears, eyes, nose. Yeah. Wonderful.